So the first thing we're going to do is we're going to check something called the ileocecal valve. Ileocecal valve is over here at McBurney's point. It's at the end of the small intestine where it meets the large intestine. So I'm going to put a fist there on Yvette's body and see if that strong indicator muscle gets weak. Now, these these points are like circuits in the body. The same way that there's a circuit here that that's working that allowed the light to be on, and if that circuit were out, we would, the light would be off. And so it's not so much that the lights are bad or that the circuit here is bad or that the electricity doesn't come to the building. It's more that the circuit over there on the wall is out. So there's some circuits that are working and there's some circuits that are not working in the body. We are checking these circuits to see if they're working. We're checking 7 secret circuits that your healthcare provider, they probably really do want to make sure that you don't find out about this. I've had a number of patients, for example, who were not able to get pregnant. One of them had tried all these different things, and then she was looking at doing these stem cells and all this kind of thing. But really, she was very unhealthy. She had a thyroid condition, and nobody had ever addressed her thyroid condition properly, nor had they helped her to really get healthy. So again, we're going to check the ileocecal valve here. Ileocecal valve seems fine, so that circuit's working. We'll check the valves of Houston on the other side. That circuit seems to be working. That's also related to digestion. That's at the opposite side of the ileocecal valve. The valves of Houston is part of the anus. It's at the very end of the colon. And then we're going to take 3 fingers, put them underneath the clavicle here, and check Yvette for blood sugar circuit. Okay, her blood sugar circuit's good. Then we're going to grab a little piece of Yvette's hair, and we're going to gently pull it and check something called protein utilization. So why don't we do that? Protein utilization. Seems fine. It's good. And then we're going to check another thing called rib torque. We're going to rotate our fingers this way and then rotate the fingers that way and see if the indicator muscle gets weak. If it does, then Yvette has a circuit out called rib torque, meaning her ribs are torqued. And when there's trouble with the viscera meaning the internal organs and glands in the body, then the ribs tend to torque. These organs or glands are also related to the dura of the body. The dura is the sac that holds the spinal cord. The dura mater, the arachnoid mater, and the pia mater are the 3 main parts of the dura. Okay, and this rib torque technique, it comes from total body modification, which is a technique that was developed by Dr. Viktor Frankl. Dr. Viktor Frankl has passed away about 7 years ago, and the company was purchased by Kevin Millay. Kevin Millay is doing a great job with the company, and it's now based out of Utah. Okay. So we're checking rib torque. Yvette doesn't seem to have rib torque. That's good. Go ahead and lie on your back, Yvette. And we're going to check a couple other things that are related to infertility. So Yvette is 38 years old. She could get pregnant at any moment. And this is important because if she wanted to have a healthy pregnancy, she'd have to be fertile. She'd have to have a healthy enough progesterone and estrogen fluctuation of the hormones throughout the 28 to 31 days of her cycle. And so this would all be important. So fortunately for Yvette, I've done a whole history on Yvette. I've had her fill out a bunch of forms and taken a thorough health history. She does have a normal cycle every month. When I say normal, I mean the length of her cycle is normal, but she hasn't always had, sometimes she's had symptoms like pain with her cycle. So the psoas muscles are related to the kidneys. The main nutrient of the kidneys is water. These psoas muscles are turning in evenly. Then we can actually check the psoas muscles to see if they are functioning or not functioning, meaning if they're facilitated or infacilitated defacilitated, so if they're facilitated or unfacilitated, meaning if they work or if they don't work. Okay. So if this muscle were to turn in more than that one, that would mean this would be a weak or loose psoas. This would be the tight psoas. But they're turning anyway. Okay, go ahead and push straight up into my hand here, breathing. Okay, so that psoas seems to work okay. The muscle is able to resist the force I apply to it. Relax for a second. Okay, and then push straight up into my hand a bit. And that psoas muscle seems to work properly. So that muscle is also able to resist the force I apply to it. And then I'm going to put my hand here. Okay, go ahead and push straight up into my hand with your legs. Push, push, breathing. And those muscles give way. That's checking for something called cardiac low back, which is related to the heart, also coming from Dr. Viktor Frank. So we did a lot of interesting things, and I hope you found this helpful. So what does this have to do with fertility? Everything. So if a person can't digest their food properly, which is what we're learning about when we check the ileocecal valve and the valves of Houston, then they won't be able to take in the raw materials needed to metabolize progesterone and estrogen, and to even be able to have the proper stimulation coming from the pituitary with follicle stimulating hormone and luteinizing hormone to allow the correct rise and fall of the hormones throughout the course of the month. So that's important. Then when we check blood sugar, if a person's blood sugar is imbalanced, they have trouble with their thyroid very oftentimes. Not always, but most of the time they do, if it's a real serious blood sugar imbalance. And when they have thyroid disease, they can't have proper progesterone levels. And then they may be able to get pregnant, but not carry out a healthy pregnancy. Okay, so blood sugar is very important. Then the rib torque, like I was telling you, is related to the organs and glands in the body. So as you can imagine, having healthy organs and glands is very important to not only getting pregnant, but also carrying out a healthy pregnancy and having a healthy child. Because many of these fertility clinics will allow you to get pregnant and carry out the pregnancy, but then you end up with a sick child with all kinds of allergies and all kinds of difficulties. And that's terrible. That's no good. Okay. The other thing that we checked was kidney function. So often women are getting pregnant, and then they're going to their local hospital to give birth, and then they end up with pregnancy-induced hypertension. So that's a problem. Now, pregnancy-induced hypertension, hypertension and is sometimes relating to the kidneys. They call that renal hypertension. It's not always related to the kidneys, but sometimes it is. And so kidney health is very important when you're looking at proper blood pressure. And a good way to have nice, normal, healthy blood pressure is to be properly hydrated, to watch a person's salt intake. Do you ever have salt cravings, Yvette? Sometimes? Okay. So sometimes people have salt cravings when they're having a little bit of trouble with their kidneys or with their adrenal glands. The adrenal glands regulate the sodium-potassium balance in the body with aldosterone. Aldosterone is the mineralocorticoid that comes from the adrenal cortex. So at any rate, checking the kidney function, checking the proper hydration, checking to see if blood sugar is balanced. And there's also something called, pregnancy-induced diabetes, or not diabetes, but, it goes away when the person's no longer pregnant, but it sets in at the time of their pregnancy. So it's better just to avoid all that stuff and get somebody who can really understand the interrelationships of the body and how to help. Thanks for coming out and watching. I hope this has been immensely helpful. Thank you.